Today, we'll be talking about the sequence of patients' transportation in areas with mass casualties. A brief introduction. At some time in their career, many doctors will deal with a road traffic crash or an accident, and safety for yourself at the incident scene is the first priority. Doctors untrained in pre-hospital care should concentrate on giving good first aid, working under the direction of ambulance service staff, providing excellent medical treatment at a road crash requires specific training and experience. Patients with airway and breathing problems may need intermediate pre-hospital advanced medical intervention. The treatment should be aimed at promoting oxygenation and preserving clot, with rapid patient movement to a hospital with the appropriate facilities to provide definitive care. The sequences include approach. On arrival at the crash scene, the pre-hospital care doctors should introduce themselves to the ambulance staff and should liaise with the senior fire service and police officers on the site. The scene of the road traffic crash is always dangerous, and the drivers of passing vehicles will be distracted and may hit rescue workers or the wreckage. Second of all, the initial patient assessment. The basic sequence of medical priorities is much the same as in hospital trauma care. A primary survey is carried out and any critical interventions are performed. The emphasis is on finding conditions that might cause deterioration or death during extrication, such as airway obstruction, hypoxia, or tension pneumothorax. Thirdly, coordination of physical and medical rescue. After the initial assessment, the medical team must speak to the senior fire officer. Extrication of trapped casualties need close integration of physical and medical rescue, which requires that pre-hospital care doctors understand fire service extrication procedures and terminology. The further patient assessment. After extrication, the patient is reassessed. Pre-hospital medical intervention should address each patient's needs, giving the right intervention at the right time. There is a major emphasis on airway and breathing interventions. Intubation without anesthesia is unlikely to be of benefit. Increasing importance is attached to preventing hemorrhage by preservation of the body's natural clotting mechanism. Intravenous infusion, although traditional, now has less priority because of the lack of evidence of benefit and possibility of harm. Next, we move on to packaging. Patients should be packaged for transport with a hard cervical collar, head blocks, limb splints if required, and a body splint such as a scoop, stretcher, or a vacuum mattress. Spinal immobilization is a standard procedure worldwide, although no appropriate trials have been carried out to show whether this is of benefit or harm. Next is the appropriate hospital for definitive care. These are often several possible hospitals to which a patient can be taken. Time to definitive intervention, usually surgery, is an important determinant of outcome in some patients. Lastly, the transport process. The transport of a patient from a crash scene to hospital accounts for a relatively small part of the total pre-hospital time in most urban and semi-rural areas. Monitoring and treatment need to continue throughout this time as deterioration is common during patient movement. Helicopter transport can be used to cover large distances from remote areas to avoid congested roads or to increase the choice of hospitals to which a patient can be transported. Those that are responsible for moving patients from one scene to another must also be aware of the pros and cons of casualty evacuation. The emergency personnel, first responders, disaster planners, and anyone else who may be tasked from evacuating patients must recognize all the options available to every scenario, both planned and impromptu, will be understanding three essential components. An honest appreciation of the current situation, knowing all the resources that are available and their capabilities, and understanding the desired and state and effective communication of the same.